So the dental insurance here at Coconino County is through Delta Dental of Arizona. The county's group number is 1331. For dental insurance, we offer a base and a buy-up plan. Both plans are the same for the most part. The major difference between both plans is the annual maximum benefit per year. Under the base plan is $1,000. Under the buy-up plan is $2,000. Routine services are covered at 100%, and adult cleanings are covered for per year. And an adult is someone who is age 14 or older. Please keep in mind, if you do get 4 cleanings per year, it does chip away from the annual maximum benefit that you have available. Basic services such as fillings, extractions, and root canals are covered at 80%. Major services such as crowns, dentures, bridges are typically covered at 50%. There is an orthodontic benefit for dependents aged 8 through 19. And if you are considering getting braces for your child, please get them banded before age 17. There's a $1,000 maximum lifetime benefit, and the calendar year deductible is $50 per family. $50 per employee, $150 per family. With respect to dental insurance, you can cover your dependents, the adult child up to age 26 without regard to college student status. The base plan for employee only is the free plan. The base plan for family is about $42.76 per month. The buy-up plan for employee only is $13.60 per month. The buy-up plan for family coverage is $74.10 per month. If you divide the premiums by 2, that will translate to the biweekly premium that is withheld from your paycheck. And remember, the default plan for dental insurance is the single base, which is free. Vision plans is through VSP, and the group number is there. So under VSP, we offer a core plan for employees only, and then we have a buy-up option for employees and families. So under the core and the buy-up, you can get an eye exam once every 12 months for a $15 copay. Also, under both plans, you have access to the True Hearing benefit, which is a possible discount on a pair of digital hearing aids if you go through a VSP provider. Also, under both the core and the buy-up is the laser vision correction possible discount if you do get that procedure done through a VSP provider. Under specifically just the core plan, if you purchase a prescription eyewear, a complete prescription eyewear from a VSP provider, you'll get a 20% discount, or you can get a 15% discount on the contact lens exam. And this is an either or benefit, so you either get a discount towards prescription eyewear or the contact lens exam. Under the buy-up option, there is coverage for prescription glasses and frames. And under prescription glasses, there's a $25 material copay once every 12 months. Frames, a $25 copay for lenses once every 24 months. $150 frame allowance. If you purchase a mark-on frame benefit, there's an extra $20 savings. And overall, you get a 20% discount on the prescription eyewear. Here again, it's an either or. You can't get prescription glasses and contacts. You have to get one of them. If you want contacts instead of glasses, there's a $130 allowance, and that's once every 12 months. And then there's additional testings under the buy-up plan with respect to Diabetic Eye Care Plus, a $20 copay for services related to diabetic eye disease, glaucoma, and age-related macular degeneration, retinal screening for eligible members with diabetes. With vision insurance, you can cover your adult child dependent up to age 26 without regard to college student status. The employee-only core plan is free, and that is the default plan. And the default plan, I mean that by if you don't go into the online benefit center and submit your benefit elections, that with respect to vision, it's the single core plan is what you're set up with. Okay. If you are interested in the buy-up option for employee only, it's $6.40 a month. For family coverage, it's $15.24 per month. Our life insurance plans is through Minnesota Life and Securian Life. So everyone who is benefits eligible, the county pays for a $40,000 basic term life and accidental death and dismemberment insurance policy on your behalf. Does not cost you anything. All that is asked of you is to maintain your beneficiary information in the online benefit center, and you can port this into your own name upon separation of employment. So what that means is you can get this life insurance policy into your own name, and you would just pay the Minnesota Life directly for the monthly or quarterly premium, however they bill you. And if you are interested in additional life insurance for yourself, your spouse, your child, or children, you're more than welcome to apply for that. For employee voluntary life insurance, guaranteed issue is $150. So no questions asked. If you are eligible for that amount, you will be approved for that and not be subject to underwriting. And the maximum amount is $500,000 or not to exceed 5 times your annual salary, whichever is lesser. With respect to voluntary life insurance for spouse, they can get up to 100% of the total employee coverage. So with the basic life insurance, that's $40,000. Plus, if the employee gets any voluntary life, that's the maximum that they could get covered for, and the guaranteed issue limit is $50,000. If you increase the spouse coverage during open enrollment, that would be subject to underwriting, and the maximum for spouse insurance is $250,000, not to exceed 100% of what the employee elects, and plus the basic life insurance. You can insure your children or child up to $10,000 each at time of new hire and not be subject to underwriting. And you can port this coverage, accidental death and dismemberment coverage, on basic life as well as voluntary life insurance at separation of employment. Retirement systems. We participate in a couple of state retirement systems. Majority of our employees are covered under the Arizona State Retirement System, ASRS. The contribution rate for FY19 is 11.8%, and the employer, the county, matches that at 11.8%. If you work in the county detention facility as a detention officer, you will be set up with the Correction Officer Retirement Plan, Sheriff's Office, and your contribution rate is 8.41%, and the county will match that at 17.75%. If you are part of the Correction Officer Retirement Plan as a probation officer or youth care worker, you'll be set up with Corp AOC, your contribution rate is also 8.41%, and the county puts in 32.98%. With respect to Public Safety Personnel Retirement System, PSPRS, your membership is broken into tiers, tier 1, 2, and 3. And additional correspondence will be gathered from you to determine which tier you belong to, but their contribution rates are set there. If you are brand new to PSPRS completely, most likely you'll be part of the tier 3 membership, and you have a choice to pick from a defined benefit plan or a defined contribution plan. So please make sure to complete your membership form at time of new hire, and we'll get that to the retirement system, and they will email you information that will educate you on the defined benefit and the defined contribution plan, and you have approximately 90 days to make your election and get that back to public safety, who will ultimately communicate that to the county. If you don't respond to that, the default is the defined benefit plan, and it's for members hired into the system as of July 1st, 2017. That would be a tier 3 member. For the elected officials contribution retirement system, the rate is 8.125%, and the employer contributes 23.625. If you are part of the correction officer retirement plan, you have the option to get the cancer insurance program at time of new hire. It's those available to those who are currently enrolled in CORP, who would be probation officers, youth care workers, detention officers. You have an opportunity to participate in this insurance program at time of new hire. It's a voluntary program with $100,000 of coverage and annual premium of $50. If you do sign up, please complete the enrollment form as part of the onboarding process. Once you enroll, you cannot disenroll at a later date. If you don't enroll as a new hire, every year during open enrollment, you have the option to enroll. But there again, once you enroll, you cannot disenroll at a later date. There are changes with the Correction Officer Retirement Plan Sheriff's Office. These changes will begin July 1st, 2018. It does not impact the current Correction Officer retirement members. Rather, only impacts those new hires who begin work on or after July 1st, 2018. After this date, newly hired detention officers who work in county jails will receive retirement benefits through the Public Safety Personnel Defined Contribution Plan. This is a 401A plan which employees and employers contribute towards the employee's retirement. This reform closes the Correction Officer Retirement Plan to new members from detention positions. The 401A tax-deferred retirement plan is administered by Nationwide Retirement Services and managed by the PSPRS Defined Contribution Committee. With respect to Corp AOC, after July 1st, it is important to note that Corp will remain open for new hires of the Arizona's Administrative Office of Courts, Probation, and Surveillance positions, including youth care workers here at the county. Those hired into these positions will be given a choice of retirement benefits from the following: a pension provided by the Correction Officer Retirement Plan, or a 401A account with employee contributions and employer match, 7% default employee contribution rate, full matching employer contribution of 5% of the member's salary, State law prohibits 401A defined contribution plan employees to make a one-time and final decision to lower their employee contribution rate. Some important reminders through the Online Benefits Center, napepbenefits.com. You have a 2-week window to submit your benefit elections and contact HR if you haven't been notified of your enrollment window. If you don't submit any benefit elections, the default benefit elections will remain. For medical, that is employee-only high-deductible health plan with no employer contribution to your HSA or FSA. For dental, it's employee-only base plan. For vision, it's an employee-only core plan. You will receive a member ID card from Blue Cross and Delta Dental that says you have these plans. Vision VSP does not provide member ID cards, so you will not get a member ID card from VSP. The Wellness Portal is another important website to remember, mywellsite.com/NAPEP. You have until May 15th to complete your wellness incentive points, which will be applicable to the next plan year FY20.